All right, time for one of my favorite lectures. We are going to go over fetal circulation. Hopefully you'll find this very interesting and it will be super helpful for several NCLEX questions. So let's get started with some of the basics. In fetal circulation, we have a closed loop system. Blood is going to travel from the mother to the fetus via the umbilical vein, of course. There, the blood will deliver nutrients, oxygen, absolutely everything the fetus needs, and it will absorb all the waste products from the fetus and return them to the mother through the umbilical arteries. So blood to the fetus in the umbilical vein, we just have one umbilical vein, and then blood back to the mother via two umbilical arteries, closed loop system. Here is a picture of the umbilical cord to kind of go more into that vein and arteries. The umbilical cord, very important because that is what carries blood to and from the placenta, which is of course how the fetus receives oxygen. Two arteries you can see there in red, and then one vein in blue. So it's actually three vessels kind of all encased in that cord. And it's surrounded by a jelly-like substance called Wharton's jelly. That's what keeps it all together, and that's what you see on the outside when you see an umbilical cord. The umbilical cord, of course, connects to the placenta. You can see the placenta there right in the middle of the picture. The placenta is where oxygen will be delivered to the fetus, nutrients delivered to the fetus, everything they need for a happy life, fully supported by mom in utero. It is also where waste products will be removed from fetal circulation and brought back to the mother for excretion. So the fetus gets and gives back everything it needs in that closed loop system from mom to placenta to umbilical cord to baby and then back. And that is the overall big picture of how the fetus gets blood. So now let's dive into the circulation of the fetus once it actually receives the blood from mom, because that is a little bit different than the typical adult circulation. Probably the biggest reasons that they're different are the three bypasses, so to speak, that exist in fetal circulation. These exist because we don't want any blood going through the lungs and the liver of the fetus. Why? They are not fully developed and they're just not working yet. The lungs are still filled with fluid. The alveoli cannot exchange gas and perform all the functions of the lungs that the baby needs to. The baby is living in the amniotic sac full of amniotic fluid, so he's not taking breaths. There's no gas exchange occurring in the lungs, so we need to skip pulmonary circulation. The liver, just the same. It's not working yet. It's not able to perform all of the filtration functions that an adult liver is. So we need to skip hepatic circulation. We need to keep it all systemic. Therefore, we have these three bypasses. They are the ductus arteriosus, the foramen ovale, and the ductus venosus. Let's go over all three of those in more detail. First is the ductus arteriosus. This is a hole that connects the pulmonary artery to the aorta. So you can see in that picture, I have it labeled here. The aorta is arching over in red, and then the pulmonary artery is just under it in blue. And we have a nice opening or little shunt right there between the two where you can see the blood mixing. That is the ductus arteriosus, and it is patent or open in this picture because we are in fetal circulation. And in fetal circulation, the ductus arteriosus is open. So instead of blood leaving the right ventricle, going through the pulmonary artery and into the lungs for pulmonary circulation, as it does in you and I, the blood is going to skip the entire left side of the heart. It's going to go through the right ventricle, over, it's going to try to go through the pulmonary artery, but it's going to mix in that PDA, go into the aorta, into the systemic circulation side. So instead of passing into the lungs from the pulmonary artery, the ductus arteriosus allows it to bypass the lungs and just go directly into systemic circulation. Another reason why this works is because there's really high pressures in the fetal lungs. This is due to all the fluid filling up the alveoli, preventing blood flow from the pulmonary artery entering the lungs. Blood is always going to follow the path of least resistance. So when there's really high pressures in pulmonary circulation due to that fluid in the alveoli, the blood isn't going to try to push past that to get into the lungs. It will just take the path of least resistance, which will be through the ductus arteriosus into the aorta and out into systemic circulation. So this is just one of the ways that we bypass pulmonary circulation. The other is the foramen ovale. Let's look at that one now. This is the second opening in fetal circulation that prevents pulmonary circulation, and this is simply an opening between the right and left atriums of the heart. So, as we talked about just on the previous slide, there's really high pressures in the fetal lungs due to those alveoli being filled with fluid, which means that the pressures on the right side of the heart are going to be greater than the left side of the heart because the right side is trying to pump into the lungs. There's high pressures there. Blood is backing up in the right side, causing an increased right atrial pressure. And like we said, blood always follows the path of least resistance, so we're going to have blood shunt from areas of high pressure to areas of low pressure. Therefore, across the foramen ovale, blood will shunt from right to left. So we have blood going from the right side of the heart to the left side of the heart, and then it follows normal circulation. It goes to the left atrium, through the mitral valve into the left ventricle, through the aortic valve into the aorta, and out into systemic circulation. So this is another way we avoid blood going to the lungs. Usually, blood would go from the right side through the pulmonary artery into the lungs. Now we have blood going from the right side through the pulmonary artery, through the patent ductus arteriosus, to the aorta, out to the body. And then any blood that does end up coming back to the right atrium, it's going to shunt over to the left atrium, ventricle, out to the aorta. So we have two openings that are going to allow blood to immediately go out into systemic circulation, totally skipping pulmonary circulation. And like we said, I'll emphasize it once more, this is because the fetal lungs are not ready to perform gas exchange just yet. They're filled with fluid, they're underdeveloped, and we need to preserve them, wait for the fetus to be born, take its first big breath, and then we will change over to normal circulation. But while we're in utero, this is what we need to do. We avoid pulmonary circulation, and we also need to avoid hepatic circulation. We do that with our third and final bypass, the ductus venosus. This is very simply a connection between the umbilical vein, how the fetus receives its blood, and the fetus's inferior vena cava, their IVC. This means that we skip hepatic circulation immediately. Blood comes to the fetus, and instead of going into the liver, it skips directly to the IVC. The IVC is actually what carries oxygen and blood to the fetal brain. So all of that fresh blood that the fetus is getting from the umbilical vein from the mom the brain is getting first dibs. It's going there first, which is what fetal brains need. It needs to develop. They need all that fresh oxygen. And remember, the liver is underdeveloped and not functioning yet. It doesn't have all those filtration capacities, so we need to skip it. We do not want hepatic circulation. That would be damaging to the fetus. So blood comes to the fetus from the umbilical vein. The ductus venosus bypasses the liver, sending freshly oxygenated blood directly into fetal circulation, specifically to the brain, instead of passing through the hepatic circulation. I've circled where the ductus venosus is on this image. Hopefully you can somewhat visualize blood coming through this umbilical vein here at the bottom, and instead of going through that left portal vein, you can see in purple over there, we just go straight through the ductus venosus and into the IVC, that inferior vena cava, right there connected to the ductus venosus. So those are our three bypasses, the ductus arteriosus, foramen ovale, and ductus venosus. All three of those things, they are to prevent pulmonary and hepatic circulation, preserve systemic circulation, and help the fetus develop properly. There are a few nursing considerations we want to remember when talking about fetal circulation. First and foremost, all three of these bypasses should close on their own after birth. Once the fetus takes that first big deep breath of oxygen, pressures in the lungs are going to drop, the fluid is going to clear out of those alveoli, and those decreasing pulmonary pressures should cause the ductus arteriosus to close. If these things don't happen, there's going to be issues with oxygenation and perfusion because we're about to cut that umbilical cord. The umbilical vein is not going to be there to bring oxygen and blood and nutrients to the fetus. We need the fetus to be able to do that on its own after birth. So if these bypasses don't close, we have issues. We have names for all of these. If the ductus arteriosus doesn't close, we call it a patent ductus arteriosus, or PDA. It's a very common congenital heart defect. It causes a machine-like murmur. That's kind of a buzzword for an NCLEX question. If you get an assessment or a question stem that states an infant has a machine-like murmur, you want to think PDA, patent ductus arteriosus. So remember, that means there is still an opening between the aorta and the pulmonary artery. That means not enough blood is getting to the lungs. The fetus will not be oxygenating perfectly. Many kiddos live with PDAs. It's not a medical emergency, but it is very important to know for NCLEX purposes that machine-like murmur means a PDA. And you need to know what the ductus arteriosus is and where it is located. Likewise, if the foramen ovale does not close, that is a PFO, a patent foramen ovale. Again, this is not life-threatening, and it is a very common congenital heart defect that we still have that tiny little hole between the right ventricle and the left ventricle. But a significant change after birth is that the left-sided heart pressures will increase to be greater than the right-sided heart pressures. This is because the infant is born, it takes a first big breath, it clears the fluid out of those alveoli, lung pressures drop, the PDA closes, and we start to have pulmonary circulation. When we have pulmonary circulation, the pressures on the right side of the heart drop dramatically because they're not pumping so hard trying to push blood out into pulmonary circulation. It becomes much easier on that right side. With lower right-sided heart pressures, left-sided heart pressures are greater than right-sided. Blood follows the path of least resistance, and we shunt from areas of high pressure to low pressure. Therefore, we have blood shunting left to right instead of right to left. In fetal circulation, blood shunted from right to left over the PFO, and in normal circulation in the infant after birth, if they have a PFO, blood will be shunting from left to right. Again, this is not a life-threatening cardiac heart disease. It will require intervention, either surgical or medical management. You will hear a murmur. It is just not a machine-like murmur. It doesn't have quite a buzzword like a PDA murmur does on the NCLEX, but this is very common. And most definitely could be a congenital heart disease that you see an NCLEX question about. The very last one is much less common, a PVD, if the ductus venosus doesn't close. We have the patent ductus venosus. This is very rare, and I doubt that you would see an NCLEX question about this. But let's do a couple of NCLEX questions just to test your knowledge on fetal circulation. Which of the following are bypasses in fetal circulation? Select all that apply. A, ductus arteriosus. B, foramen ovale. C, ductus pulmonic. Or D, foramen aortic. Okay, the answer was A and B. That was an easy one. Hopefully you got that. I doubt there'll be anything quite that simple on the NCLEX, but as we just went over, A, the ductus arteriosus is the bypass from the pulmonary artery to the aorta. B, the foramen ovale, is the bypass between the right and left atriums. C and D are totally made up words. There is no such thing as a ductus pulmonic or a foramen aortic, so hopefully you did not choose those because they are not bypasses in fetal circulation. Let's try a harder one this time. This is more realistic for what you may see on the NCLEX. Which of the following statements is true regarding fetal circulation? Select all that apply. A, there are high pressures in the fetal lungs, causing decreased pulmonary circulation. B, blood shunts from left to right in fetal circulation. C, the ductus venosus allows freshly oxygenated blood to go to the fetal brain first. And D, there are higher pressures in the right atrium of fetal circulation. Correct answer, A, C, and D. A was correct because in fetal circulation, the alveoli are filled with fluid, causing high pressures in the fetal lungs, shunting blood away from pulmonary circulation. B was correct. Blood shunts from right to left in fetal circulation due to the high pulmonary pressures because of the fluid-filled alveoli. C was correct. The ductus venosus is a bypass in fetal circulation, shunting blood away from the liver and to the fetal brain. D was incorrect. Pressures on the right side of the heart are higher in fetal circulation. This is why blood shunts from right to left across the foramen ovale. All right, I know this can be a tricky topic. It's helpful to kind of pass through fetal circulation a few times and follow the path of blood, see where it flows. So go through this a few times, and then you should be able to just think about the pathway of blood and figure out all of these tricky questions about pressures and where blood shunts. You will need to remember those 3 bypasses to be prepared for the NCLEX. So thank you for listening, and we'll see you next time.